GP guy a couple of weeks ago, and he had to clear me for surgery, obviously, so he asked me how I was doing. I said, I never had any pain. He says, you never had any pain? He said, I said, that's right. He says, what do you mean? Nobody ever has that. I've never met a patient who's had that experience. I said, well, what could I tell you? And then he looked at the knee, he looked at the scar and stuff. He said, damn, that looks good. Hi, my name is Bob, and I've had total knee replacement on the right knee performed by Dr. Parcells here at Seaview Orthopedic. I'd come out of the shower and I'd be stumbling. I could hardly get my leg to lift up over the shower edge to get out. And that's completely gone. I mean, I shave and shower in series again. I don't even take notice of the pain in the left leg because I'm putting so much liability on the surgical leg. The PT guy, when he first came to my house after the surgery, I had the surgery on Thursday. They discharged me Saturday, and the hospital had arranged to start home PT on Monday. He came to the house and he said, take your walk down your hall. And so I took the walk. I walked down the hall. He said, come back. I came back and he said, you know what? You're using your surgical leg as your strong leg. I said, I know. He says, you're counting on that leg to support you. I said, yeah. I mean, that's how quickly that leg recovered. I just couldn't believe the experience of that. I came to Dr. Parcells through the recommendation of a friend of mine who had recently become a patient for her knee problems. She had indicated to me that Dr. Parcells had promised her that he would try to do everything possible to avoid surgery. That was my kind of recommendation. I love that. So I made an appointment with Dr. Parcells and we began the process. I went over to Atlantic, I think it was, and I met the physical therapist. He said, let's go over to the bike and see what you could do riding the bike. I had ridden the bike extensively prior to the surgery. So he puts me on the bike, and I had noted while I was doing the earlier PT that people coming out of knee surgery tended to have to pedal the bike backwards because they didn't have the flexibility. So he gets me on the bike and he sets me up so I'm comfortable. And he says, okay, why don't you try pedaling backwards to see if you can do anything? I said, fine, but I said, I'd like to try going forward. I said, okay, but I don't think you'll be successful. Within a minute, I was up to 60 RPM going forward. He looked at me and says, doesn't that hurt? I said, no. What can I tell you? I mean, it's just that all the aspects of it were such a surprise to me. I did not expect that I would have no pain. I did not expect I had the flexibility. When I started the PT at external PT, they measured my flexibility and they had me up to 120 degrees. I said, again, you're at the end point. You're where we can discharge you, but you don't have the strength yet, so obviously you need to go through the PT.